invisible. Is that a good thing? Stay tuned for this Rohrich Knows podcast. Hi, I'm Rohrich, helping you become a better and more informed you. Thank you for tuning in to my podcasts and my YouTube channel, and now I have over 10,000 subscribers, and I really want to thank you for your interest in really helping me just to deliver some of the thoughts on what I think are important in life and wellness and in plastic surgery. So let's talk about trends. And I really usually don't like trends, but people always talk about the 20, 30 things that are going to happen, but there's only one thing that's going to be a beauty trend in 2025, and that's being invisible. And that's natural and subtle beauty. So the key byline and word here is invisible. Invisible beauty. And what does that mean by that? That means that everything we should do should be subtle, should be natural. It should be one that emphasizes less is more and achieving it that looks untouched yet stunning. And that's really what I think is a hallmark of excellent plastic surgeons and plastic surgery. Because when you see somebody that looks great and doesn't look operated on, in other words, doesn't have a puffy pillow face or overdone lips, but they look great, that's powerful. And, you know, Demi Moore is a classic example of somebody who had perhaps not the best type of surgical procedure, but now recently she's had a transformation and looks amazingly natural. That's what you want to attain for. And the same is in breast and body contouring. You want to make them look more beautiful, look more sculpted, and look harmonious, invisible. Body contouring, breast, face, nose, lips, make it invisible. That's why less is more. It should focus on enhancing the innate and natural beauty rather than altering it. It should be about creating results that are timeless and elegant, and prioritizing patient safety as much as possible with minimally invasive techniques and technology if it's possible, but then bridging to things that work with surgery. Like sometimes when you try and make a face look younger and use fillers when you're 50 or 60, it doesn't look good. That's when surgery is needed. But that requires expertise and judgment. That's why you need to know before you go and find a plastic surgeon that truly is an artist, a surgical artist that has excellent judgment. I can't tell you how important that is. So that's why, you know, doing faceless surgery in the 50s is really good, or late 40s, non-invasive techniques that work, not the ones that are kind of shams, and the use of less fillers and perhaps more biostimulators and biological stimulators like PRP, platelet-rich plasma, platelet-rich fibrin. Those are all things that will stimulate the body to produce its own natural fillers like fat. I mean, those are really, really the most important things to do. So let's start with an early intervention facelift, the Invisilift. Those are things that stop the clock, and if you do it when you're just beginning to age, then it'll look better and last longer. These things look amazing. So less is more with natural facelifts and eyelid surgery. And I would also have you go to a podcast that I just did on the eyes habit, because doing eyelid surgery that's natural and youthful looks great and looks harmonious. And that's why you've got to really be careful with eyelid surgery. Non-surgical skin tightening, same type of thing. Do things that work. You know, there are radio frequency and ultrasound technologies that actually truly stimulate collagen if you're in a younger age group, not if you're in your 50s and 60s, or, you know, because then you'll need more than stimulation, you'll need skin tightening procedures. So these are powerful things in the right type of patient at the right age. And then the power of regenerative aesthetics, PRP, platelet-rich plasma, growth factors, these are all safe. They use your own tissue to build up, you know, your body. You build up and stimulate your body to stimulate collagen and tissue regeneration, and they enhance skin health. And they reduce under eyelid hollows and fine lines. And I basically don't use fillers in the eyelids anymore in the tear troughs. I use PRP or PRF in most cases because that gives you a natural look and also corrects hyperpigmentation in these areas. And the incredible explosion of biologic fillers and fat grafting is so powerful because it gives you a permanent volume restoration that's natural, your own tissue, your own fat. I think that's so powerful, and just always want to target yourself to doing that. And then the advent of regenerative skincare with exosome therapy. These are things that boost skin healing, repair, and rejuvenation. They stimulate natural collagen and elastin production. You can't beat that. You know, platelet-derived exosomes. We like to use one that's called plated because it's platelet-derived. It's a patented formula, and I think it works fantastic. So the key is you want to make sure that this is something that's regenerative skincare that makes sense but also works well. And then the use of AI and personalized treatment planning. We are seeing so much more of the use of AI and precision and tailored approaches to skincare and to treatment planning of not only skincare, but facial rejuvenation, and seeing what works, what doesn't work, and using AI to simulate what you can look like if you do plan A or plan B with skincare, with fillers versus surgery. And AI is transforming this whole area for us. So innovating invisible beauty for 2025 should be the byline, not only for 2025, but also going forward, because it really allows you to be beautiful, natural, and regenerative all in one, and also to be very safe and powerful and using many times minimally invasive techniques and technology. So I would say, know before you go, stay beautiful, but stay invisibly beautiful, and do things that look great on you so that you not only age naturally, but age in a seamless, invisible manner. Give me your thoughts, give me your comments, and let us know how we can help you to stay invisible and beautiful. Have a great one.